My name is Crystal. I'm going to be your nurse today. We're going to perform a head-to-toe assessment. Is that okay?
Yes.
Perfect. First, I'm going to wash my hands, and I'm going to close the curtain for your privacy. Can you please tell me your name and date of birth?
Natalie Cable, 7/20/1990.
Excellent. I'm just going to check your wristband. Make sure you are who you say you are. Perfect. Are you comfortable?
Yes.
Okay, so just to explain a head-to-toe assessment, is I'm going to check to make sure everything is doing okay. We're going to start at the top and work our way down. Is that okay?
Yes.
Perfect. First, I'm going to check your head and make sure there is no lesions or anything that, off symmetry or any bumps or things like that. Is that all right?
Mm-hmm.
Perfect. Okay, no bumps, no lesions. And hair distribution is good and healthy, nice and shiny. And next, I'm going to look inside of your ears, okay? Good. No blockage. And I'm going to look in your nose. Excellent. And next I'm going to look at your eyes. Pupils are round. They're reacting to light and they're equal in size. And then if you could please open your mouth and say ah.
Ah.
Perfect. Mouth is moist. Tonsils are glistening. Tongue is red, which is perfect. And also your cranial nerve 10 is intact. And if you could just do me a favor and follow my finger with your eyes. Good. And then focus on the clock on the other side of the room, and now on my finger. Perfect. Cranial nerves 3, 4, and 6 are intact. An accommodation is good. Next, if you could do me a favor and say light, tight, dynamite.
Light, tight, dynamite.
Excellent. Cranial nerve 12, is intact. And if you could please use your finger and plug one nostril, close your eyes, and tell me what you smell.
Lavender.
Perfect. The other side?
Lavender.
Excellent. Cranial nerve 1 is intact. If you could continue to keep your eyes closed and tell me if and when you hear something.
Right side. Left side.
Perfect. Cranial nerve 8 is intact. If you could just give me a smile. Cranial nerve 5 is intact, as well as 7 for facial symmetry. And if you could shrug your shoulders. Cranial nerve 11 is intact. Well, cranial nerve 9 is intact. And if you could do me a favor and read what is on the top of this paper.
September 2017.
Perfect. Cranial nerve 1 is intact. Next, I'm going to check your lymph nodes. Please let me know if any of them hurt or if they're tender. Okay, here, submandibular, supraclavicle. Are any of that hurt?
No.
Perfect. So lymph nodes are not tender and they're not enlarged. Excellent. Okay, so next we're going to check your lungs. If I could bother you to turn around, please. Okay, so I'm going to ask you to take a lot of deep breaths. If at any point you get a little lightheaded or dizzy, let me know. Every time my stethoscope moves, if you could just take a deep breath. Okay, you doing okay?
Mm-hmm.
All right, next I'm going to check your thoracic expansion. If you could take a deep breath, please. Good. Lungs expand symmetrically, bilaterally. And if you could do me a favor, I'm going to place my hands on your back. If you could say 99.
99.
Again.
99.
Again.
99.
Good. Vibrations are bilateral and symmetrical. And next I'm going to check to see if you have any tenderness. Can you let me know if you have any pain back here?
No. No.
Good. No CVA tenderness. And last but not least back here, if you could just curl forward. Spine is straight, which is good. And you can go ahead and turn around. Perfect, thank you. So next I'm going to check your lung sounds in the front, and then I'm just going to go straight into the heart sounds. Is that okay?
Yep.
Perfect. So just a couple more deep breaths. Okay, I'm going to check the aortic, the pulmonic, the Erb's point, the atrial, and then the mitral. And then I'm going to take your apical pulse, okay? Okay. Your breath sounds are +2, which is normal. Your respiration rate is 18. Your heart rate rhythm is good. There's no arrhythmia. And the depth of your lungs sound perfect. Lungs are clear. Okay, so next we're going to check your pulses. So first I'm going to check your carotid, one at a time. Good, pulse is present. And then your radials. Good. And your brachial. Good. They're equal on both sides. And if you don't mind lying down for me. Are you comfortable?
Mm-hmm.
Okay. So I'm going to check your popliteal pulse, your left, and your right, and your dorsalis pedis, your left, and your right. And there it is. And then your femoral. Good. And then next, we're going to listen for vowel sounds. So are you ready?
Mm-hmm.
Vowel sounds present. Good. Vowel sounds are there, and your contour is straight, which is good. Skin looks healthy, and color is appropriate for your ethnicity. And then next, I'm going to place my hands on your abdomen and tell me if there's any pain or tenderness. Here?
No.
Here?
No.
Here?
No.
Good. So there's no sign of pain or tenderness. And then, when was the last time you had a bowel movement?
This morning.
Perfect. And then, are you having any trouble urinating?
No.
Excellent. So I'm going to check your legs for edema and any like lesions or sores or anything like that. Okay? You can go ahead and put your shirt down. So you have no edema. Excellent. Your temperature is warm to the touch. And then, if I could just bother you to stand up, please. All right, and then if you could please walk to that wall and back. Perfect. Gait is good. Steps are perfectly proportioned. Hips are straight, and the patient is dressed patient is dressed appropriately for the season. Hygiene is good. I just need you to close your eyes. Put your hands at your side. Okay, Romberg test is good. Posture and balance are good. You can go ahead and open your eyes. And if you could just put your arms out and in. Good. And then if you could put one leg up and down and the other leg up and down and flex your toes. Good, perfect. Full range of motion, excellent. Any pain when you do that? Perfect. If I could just have you put your arms up like this, and I'm going to push up against your arms and I need you to resist. Okay, and I'm going to pull, resist. Good, strength is good, balance is good. And then next we're going to check your reflexes. You can go ahead and take a seat on the table again. All right. Before I check your reflexes, actually, I'm going to check your capillary refill. Good. Blood returns in less than 2 seconds. Good. So next I'm going to check your reflexes. So go ahead and just relax your muscles. First I'm going to check your bicep reflex. You're going to just put your arm here, put some pressure, and good. Muscle reacts. Next I'm going to check your tricep. Good. And then next your brachioradialis. Guess I need that. Oh, good. Very, very reactive. And then I'm going to check your Achilles. I'm going to lift up your leg here. And check. Ooh, sorry if that hurt. Good. I'm going to check the ankle clonus. Good. No tremors present in this side. Achilles. Good. Ankle. Good. No tremors present. And then I'm going to check your plantar and patellar. So first, the plantar you just rub.
You scrape up and then out, like a curve.
And the patellar,
and patellar is the tap on your knee, or
okay.
that makes your knee jerk. The knee jerk is
okay.
what it's called.
Okay. I think I might just do them all because it's going to be kind of choppy. So I'm going to, okay, so brachioradialis I should do first, and then bicep, then tricep, then patellar,
then go down
then
to
Achilles, then ankle clonus, then while your foot is here, patellar, patellar, and then plantar, and then that's it.
Yeah.
Okay. Ready? Okay, so next we're going to check your reflexes. Go ahead and relax your muscles. We're going to start with the ones on top. If I could just see this hand here. We're going to check your brachioradialis. Good. Reactive. And then your bicep. Good. Muscle reacted. And then your triceps. Good. And the other side. Good. And your bicep. And your tricep. Good. And then we're going to do your patellar. I'm going to check your Achilles. You probably can't see it. Oh. Alright, and then while I'm down here, I'm going to check for ankle clonus. No tremors present on the right. No tremors on the left. That's excellent news. And I'm going to check your plantar, excuse me. Good. Feet are reactive. Excellent. Reflexes are good.
Sorry, I got you hooked there.
It's okay. Okay, so that concludes our assessment. And you did great. Everything looks perfect. I'm just going to wash my hands. And I'm going to step out, and the doctor will be in to see you soon, okay?
Okay.
Perfect. Okay.